So in Module 8, now we get to how do we treat these anxiety disorders? And there's a variety of approaches that you have to choose from, many of those that you've already been exposed to when we were talking about general treatments for psychological disorders. So let's look at those that apply maybe more specifically to anxiety. The first one is the psychoanalytic. If you remember, this is the one related to Freud's technique. And the emphasis here is on fostering insight regarding unconscious motives that presumably lie at the heart of symptoms. And so, for example, one of the ways that we use defense mechanisms, according to Freud, is that we are dealing with the anxiety of unresolved unconscious motives. And so, what you're trying to do is get some insight as to what unconscious motives are creating this anxiety. So this is probably not one of the more popular approaches, but it is one that you could apply. One that's probably more likely if you ever went in for anxiety, especially when you talk about a particular phobia, not more generalized anxiety. So this is much more of a specific for a type of phobia that people may be trying to get over. And that is either exposure or systematic desensitization a lot of times. So basically, it's exposing yourself to the feared item and desensitizing that fear. And what you do is first, a client's going to be taught how to do progressive muscle relaxation. And this is where you go ahead and start at the top of your head and each of your limbs, and you gradually tighten those and loosen and tighten and loosen. And so basically, what you're teaching the client is to go ahead and relax, a state of relaxation, and also juxtaposing that with tension. Tense and relax. So you can't be tense and relaxed, it's impossible. And so the next thing you do is create a fear hierarchy. So you make sure the patient's relaxed, and then you gradually go up the levels of fear. So, for example, you might start off if somebody's afraid of a snake. You first expose them to the word snake. Okay, and that's very little. And then next on their hierarchy would be maybe a picture of a snake. And then next on the hierarchy would be a video of a snake. And then the next on the hierarchy is a live snake, but in another room that you're looking through a window. Eventually, you get up to the point where you're in the room with a snake, and then finally, maybe you're even got the snake in your hand or around your arm at the ultimate end. But you're not going to rush to that last stage. It's going to take time. And every time that you're about to get exposed, the individual therapist would go ahead and prepare you for being that exposure and getting you into a state of relaxation. Now, usually direct what they call in vivo exposures, and that means actually being exposed to those things rather than imagining them, tend to work better. So in other words, concrete versus just I want you to picture kind of way of doing things. Now, there are kind of exposure treatments. There's even something called flooding, where the individual is just immediately shown into their highest area of their hierarchy, fear hierarchy, and then they just stay there until they eventually calm down because nothing happens. Some of the different types of exposure that you might see for panic disorder, you got situational exposure. That's repeatedly confronting a situation that you've previously avoided. And that goes back to the classical conditioning that we talked about as a possible cause, because the secret behind classical conditioning is if you go ahead and get exposed to something over and over again, and that unconditioned stimulus doesn't occur, then it breaks the chain, okay, and the two become neutral again, and therefore the anxiety or the phobia goes away. Interoceptive exposure, this is aimed at reducing the person's fear of internal kind of bodily sensations that they may frequently associate with, say, the onset of a panic attack. And so what people would do, what a therapist would do, is help them engage in some standardized activities that produce physical sensations much like the ones that they are kind of hypersensitive to, and yet not being a panic attack. So to get that feeling of dizziness, you may spin in a swivel chair. to get a little bit breathless or raise your heart rate. You may run in place to mimic that. You may breathe through a narrow straw to kind of represent the lack of oxygen flow. Okay, so you can get an idea. Sometimes to feel lightheaded, they'll have somebody kind of put their head between their legs and then raise up suddenly, so they get that lightheadedness feeling. And the idea is to get those in a setting that is not associated with a panic attack. So once again, you're breaking those connections there apart to allow that person to relax more effectively. Okay. Then we also have virtual reality, I should say, is also being used increasingly. And I have an Oculus, and it is somewhat amazing on what that thing can do and how immersive it is. So I think that's probably a real future as we talk about future treatments down the road here. And then relaxation, as you can tell, throughout all the systematic desensitization exposure techniques, the relaxation part is so important. It's very useful in the treatment of generalized anxiety disorder, and practicing slow breathing can really be helpful, especially in the treatment of panic disorder, because, of course, those panic attacks are that constriction of the breathing process. And once you relax, then you can get full deep breaths. With relaxation training, you want to teach the client kind of to tense and relax, like we talked about with progressive muscle relaxation, and really doing deep breathing, nice in and out while you're doing that. And then breathing retraining really is more an educational effort about the physiological effects of hyperventilation and how to practice these more slow breathing techniques. So a lot of this breathing, it can help with any type of anxiety, but particularly effective for things like those who experience frequent panic attacks. Okay. So that's the first taste of treatments for anxiety disorders. And in the next module, we'll go ahead and continue to explore some of the options available to you. So stay tuned for Module 9.